So my name is Dr. Jacob Stutz, and I'm the owner of Elite Physical Medicine in Frisco, Texas. And we joined AMI in September and attended the symposium in October. And since then, my staff has doubled. I've added a nurse practitioner, an office manager, a case manager, who are all here today attending the classes. And to see them in trainings, you can tell that they're finding some truths in healthcare, which is hard to find these days. One of the success stories that we've had recently, we had a patient who came in as a 40-year-old woman with a torn rotator cuff. And she had been to her primary care physician, had been given painkillers, muscle relaxers, had done the typical PT course, was referred to an orthopedic surgeon for a consult, was told she needed surgery, became nervous and got a second opinion, which also told her, yeah, we need to operate on you. And so she decided to go visit the crazy chiropractor down the street, and that's how we found her. And we did a regular course of care, and at the end we got her pain levels down and her function back up to maybe 50–60% of what she used to have, but realized that we had hit a bump in the road, a barrier. And so we decided, well, let's begin implementing some regenerative therapies. And so injected her with some signaling cells, and within just a matter of weeks, she was coming back and had full range of motion, no pain, was able to use that arm and shoulder and be a mom again, be a professional, and get back to her old life, to who she used to be. And for us, that was eye-opening. It was, oh my gosh, we gotta get on this. Like, this is a much better, safer, more effective way of treating people, is letting the body heal itself. And so it's been a wild ride ever since, but wow, we love it. It's been great. I chose AMI after a long due diligence cycle, and I have a lot of professional mentors or people that I look up to, and they have all also been impressed and have done well in the AMI model. And so it helps to have your own decision and the decision of your colleagues and people that you trust to head in the same direction. And so for that, it has always felt right. And now that I'm a member and part of the AMI model, I wish I could go back and tell my old self, who is still thinking about it, to get off the fence, to make it happen, and you'll be fine. And this is a much better way, more effective way of helping people.